Well, good morning, everyone. How are ya? And once again, welcome to another live this morning. And we appreciate you guys coming on with us when you can. And thank you for joining us. And let's see who's coming up first here this morning. Let me see. I'm going to bet Brahim. Andrea, I should have bet on you. Brahim is number 2. Let's see. Lise from Kitchener, how are you? Sylvia, good morning to you. John, how are you? And Janice from Brampton, nice to have you on with us this morning. There's Nick from our staff. Sandy, Fergus Falls, Minnesota. Michael, there he is from Norland. Hi, Keith, how are you? Fran from Orangeville. Jeanette, how are you? Barbara, Thetford. Elaine, St. John's, Newfoundland. Linda, New Brunswick. Nellie, how are you? Kelly, London. Linda, oh, those Lindas. Jeanette, how are you? Mike, hey, there's Dr. Bennett in Newfoundland. How are you, my friend? Marilyn, Kelowna, Lise. I'm not in Florida. And Georgie, Halifax, Nova Scotia. Sharon, how are you? And Cheryl, cold West Virginia. Well, it's colder here, I guarantee it. Janine, how are you? Carol, West Virginia, well represented. Sandy, how are you? Donna, Bell Valley. Donna, hey, we got at least 3 Donnas on us. Sharon, I missed you. I didn't mean to. Gary from Bolton, good morning. Jyoti from Whitby. Sue, St. Petersburg. Brahim. Rosalinda, up in the clouds. Brenda, Bancroft. Lorraine from Oshawa, good morning. Donnas. Lots of Donnas this morning. I love it. Arlene, Yvonne, Petawawa, and Norma Jean, Marlene, Newfoundland. Germaine, how are you? Deb from Timmins, minus 18 Celsius. Carol, Shirley, and Vanda from PEI. Okay, guys. Janice, cold even in Brampton. Nativity, how are you? And Janet from, I think, St. Joe's Island, right? Colleen. Maureen, Penticton, British Columbia. Sandy. And Patricia. I don't know how you pronounce that, Patricia. Micheline. Milika. And Yvonne. Thanks for coming on. Wendy from Hot Springs, British Columbia. And Judy, Port Perry. Okay, guys, let's get going. Got a lot of questions. Okay, Dr. Martin wants, Trudy wants me to do a session on interstitial cystitis. I could. And maybe I will. If I see a study again, let me just tell you, okay, what's interstitial cystitis? Well, it's not fun. A lot of women suffer from it. Pelvic pain, frequently going to the urinating, sometimes painful even during intercourse and whatever. Pelvic pain, no fun under the sun. Here's what I saw in my office, okay, with women with interstitial cystitis. Inflammation, no fun. Here's what I saw, almost invariably, okay? 1, way too much estrogen. Not enough progesterone. Hormonally, they were out of balance. I'm trying to think if I ever saw an exception to it. Maybe, but I don't remember. Too much estrogen, too much of a woman, not enough progesterone. Okay? 2, They usually were loaded with yeast, fungus, Candida albicans. Okay? Leaky gut, leaky pelvic floor, leaky bladder, almost invariably again, and major candida. So obviously I would work on that, okay? And too much, and by the way, too much insulin. They had insulin resistance, okay? So here's what I would do. And it often came after frequent use of antibiotics for bladder infections. That's probably where the yeast comes from. Okay, you kill all your good bacteria. Remember that pelvic floor in a woman. Okay, think about it. Okay, think of the anatomy there. It is a breeding ground for yeast. And antibiotics, they wipe out all the good guys, and then you get a proliferation. And oftentimes doctors, even for interstitial cystitis, will have them on an antibiotic. That's not what they need. It's not what they need. So I would have them, okay, for months. Broad spectrum probiotic to kill the yeast. Oil of oregano to kill the yeast, okay? For months. I would have them on a DIM, lowering estrogen, okay? And oftentimes I would use the menopausal formula, even if they weren't in menopause. Why? Because our menopausal formula drives up progesterone and dims out estrogen. I'd put them on it. And the reset, lower their insulin. Lower their insulin. They had insulin resistance. And of course, dietary, don't feed the bears, because sugar is the worst thing for interstitial cystitis. Now, many I would give the high DHA because of the inflammation there. And it's very anti-inflammatory, curcumin and others. I always had them on Navitol because it was my go-to. But those other things that I talked about earlier would be that I always look for the deficiency or what was going on, and that's how I treated people. Trudy, thank you for that question. Nicole is asking, is it dangerous to have cholesterol deposits in the brain? Well, look, it's dangerous because of why are they depositing? See, guys, cholesterol is never the bobo, okay? It's not the big problem. I got cholesterol in my arteries. I got cholesterol deposits in my brain. I know, but why is cholesterol there? Cholesterol's not the bad guy. Cholesterol was just coming as the ambulance or the fireman. You don't blame the fireman because they're at the scene of a fire, right? You don't blame them. They're on your side. Cholesterol is always on your side. But if it gets deposited, it's usually because there's an underlying thing. And if it's in the brain, like plaque, okay? Cholesterol's there, but it's not the bad guy. So what I would be doing is a big thing. I'd have them on high DHA to lubricate that area, lower the inflammation in the area. Navitol, because it elevates your nitric oxide, opens up the blood vessels. That's the key. You want to get more blood supply in that brain. And I'd have them on the reset. 30 days, get off the sugar. Sugar destroys blood vessels. and you want to, help that as much as you can. Like I said, cholesterol is not the issue. It's secondary. And just lowering cholesterol ain't going to fix that. You have to increase the blood supply in the brain and allow the brain, even good sleep will help. The brain will detoxify itself. It's very capable of regeneration. Okay? Nicole. William, just wondered if the doc has any thoughts on taking NMN. What is it? Neoclide? I can't even think of what it is. It's a precursor it's a precursor to, what's that? NAD. Okay? So what? They tell you it's anti-age. Look, again, William, I got to do this every Friday. So, bear with me because I do it every Friday. Because people ask me, William, every week about something new. I had a radio show for 20 years. Every week they'd ask me about, what about this product? What about that product? I don't mind answering. I just got to tell you, okay, I haven't seen a lot of research on NMN. Okay? Let me get the name. Nicotinamide mononucleotide. Nucleotide. Say that fast. That's why they say MNN, right? I don't know. I never, again, I always have to compare it to what I know. They talk about it's very good for anti-aging. It helps with your insulin. Man, I don't know. I got stuff that, in my opinion, is far superior, William. Okay? I had a few people tell me they liked it, but, generally not a lot. And if I scoured the research on it, there wasn't much. Now, it's a supplement. You can get it in Canada. Would I do it? Nah, because I would tell you, look, here's what I'm going to compare it to. Navitol, pine bark extract. And by the way, okay, and I wanted to do this next week because there was I saw an article. Let me just read the headlines to you, and I'll probably break it down to you next week. Okay, where did I put it in my notes here? I just saw it. Hold on a minute. Let me just talk about, my word. I got a lot of writing. 40, okay, article in the Journal of Nutrition. Listen to this. 40 randomized studies, gold standard studies on pine bark extract. Okay? 40 randomized studies, the gold standard of studies. Looking at other studies, putting them together, and coming out with some conclusions, okay? And I'll bring this to you next week. But nothing, guys, I can't think of anything, including vitamin D, that has as many studies as pine bark extract in terms of a supplement. And a lot of people have never heard of it. Okay? I wrote a book about it. Is it behind me there somewhere? Okay? Le Pain de Vie. I wrote it in French. The bark with the bite. Pine bark. Okay? And the first thing that I ever discovered about it, and I wrote a book about it, and I published papers. It's the only published research that I ever did. And it was only a clinical trial on chronic fatigue syndrome and fibromyalgia, how good it was. But these 40 randomized studies, it just talks about how good it is. It's a powerful antioxidant, anti-inflammatory, powerful circulatory supplement, the woman's health, menopausal symptoms. Anyway, yada, yada, yada. From one chronic fatigue syndrome, I started them studying that when I did my dissertation. Okay, anyway, that's, you see, William, that's what I compare it to. And when I do that, I just tell you, well, if I was you, I'd be using pine bark instead. It's better all around, in my opinion. Okay? And the researcher's opinion. Okay, Grace. Thank you, William. Very good question. My 7-year-old grandson was diagnosed with type 1 diabetes. Okay, that's autoimmune. Okay, it's not type 2, it's type 1. Autoimmune. That means the pancreas ain't working. Okay? Now, I have my theories on why that is. Why do we see so much autoimmune today? Okay? My theory is antibiotics and maybe environmental to some extent. Anything that wipes out your friendly bacteria. And autoimmune. Leaky gut. Leaky pancreas. How's that? Anyway, okay? That's my underlying theory. Type 1, okay? Look, they've got to be on insulin because their insulin's not working. This is where modern medicine, there's a huge place for modern medicine, okay? Like, I don't want to throw the baby out with the bathwater because some people do that. Oh, I wouldn't go see a doctor if my life depended on it. Well, in the case of type 1 diabetes, your life depends on it. So a child with the discovery of insulin, I think it was Banting, hey, it's wonderful. Thank God we have insulin that we can give a child like this, right? No, I'm not, you know what I mean? Like, but, okay? But, and this, guys, there's studies coming out with this now. And I've said this for eons of time with type 1 diabetes. Okay? Yep, they need their meds. You're not curing it. Okay? It's not like type 2 diabetes. And actually, type 2 diabetes, adult onset, that happens in children too, is different because, I mean, it's a lifestyle thing. And you can fix it. You can, like an alcoholic, okay? You can put them in remission. But it's only remission. You don't cure it. It's in remission, meaning that if you don't eat right, you're in trouble, okay? Type 2. Type 1, though, is similar to that. Because what they did with type 1, look, their sugars, you put them on insulin, their sugars go low. If their sugars go way too high, they can die of diabetic ketoacidosis. Okay? Now don't put the word keto and go, oh, I told you, keto. That's what doctors do because they don't know anything about nutrition. Ketosis is good for you, but not diabetic ketoacidosis. That's a different puppy altogether. That's when the sugars go crazy, out of control, and your body is gone into ketoacidosis, that'll kill you. Okay? Type 1 diabetics, they need to eat primarily eggs, meat, cheese. And they can have some fruits and vegetables. But they gotta stay away from the sugars. And what they taught type 1 diabetics is, well, you always gotta, you better have sugar because your sugars are going low. So here's your chocolate bar and here's whatever. And that, look, they do much better when they're very disciplined and they live on steak and they live on bacon and eggs and they live on protein and fat, not carbs. Okay? Type 1. The problem is you got to undo the, I hate to say it, the dietitians. Because as soon as you get type 1 diabetes, your physician refers that child, usually, to a dietitian. Okay? And the dietitian, it's grains, and more grains. Okay? They're grain indoctrinated dietitians. The cereals, you gotta have your carbs, you gotta have bread. You're gonna die if you don't eat bread. You need fiber. That's a dietitian. Okay? God loved them. But they're grain crazy. Not brain crazy, they're grain crazy. They are. That's the way they've been taught. But a diabetic, they don't do well on grains. They do well on eggs. 100 eggs. I don't care. Doesn't matter. It's only good for them. Eggs, meat, and cheese. Eggs, meat, and cheese. Type 1. Now, like I said, you're going to have a hard time because you're going to go against the system. Okay? But I helped a lot of them over the years, a lot of type 1 diabetes. And I got them to understand food. And I said, you watch, if you you eat a lot of eggs, meat, and cheese, you watch how your blood sugars are going to be under control much better. And you're going to need a lot less insulin. But you're going to need insulin. But you'll need less of it. You're going to have less swings. And you'll feel better. 100%. Okay? I get excited, guys, but it's just because, I've been around too long, I think. Okay, that was Grace. Rhonda, help me, Rhonda. Can one reverse early stages of memory loss with the reset? I've seen it happen. And low carb lifestyle. Yep, I've seen it happen. Early. Get it early. Remember what Alzheimer's is. What do they call it? Type 3 diabetes. Okay? It's diabetes of the brain, even if you're not diabetic. What is my little expression? They're swimming in the wrong fuel. Your brain is swimming in the wrong fuel. It's got glucose and not ketones. Yep. So the diet helps, and I would have them on high DHA. Okay? High DHA. Serpa was asking the question the other day. Well, my naturopath said, high DHA, there's not enough EPA. I'm sorry. If your brain is made up of DHA, what oil do you think you need? DHA. Now, I'm not saying I don't like EPA. I do. But DHA should always be higher than EPA. Why? It's a long chain fatty acid. EPA is a shorter chain fatty acid. What's that mean? Well, long chain, the longer the chain of the omega-3 is, the better it is. Go for a ride today. Watch all the cars. There's a lot of different cars on the road, isn't there? Oh, yeah. I noticed that. There's Hondas, there's Kias, there's this, there's that. You know what high DHA is? It's the Maserati. They're different cars. All of them are good. Okay? They're good. They drive, they get from point A to B. But the high DHA is the best. And I've been saying, how long have I been saying it? Okay? People didn't even remember omega-3 in the 70s or whatever. People didn't even talk about that. And then in the 80s a little bit, because they talked about fish. And fish is good for you. And then they said, stop eating fish, because there's mercury in the fish. And how many people stopped? Right? I have fish every day. Do you hear me? In a capsule. I'm not a fish eater. But fish is good for you. Okay? Fish is good for you. I just have it in a capsule because I want that high DHA. And I've proven it to people. You want to lower your triglycerides? Yep. You want to elevate your HDL? Yep. You want your eyeballs to be better? Yep. Huh. It's my go-to. Okay. Thank you for the question. And who was that again? No, that was Rhonda. Thanks, Rhonda. Okay, Sandra. Gonna ask me another question about a product. What do I think of Synachrome? I don't know. I've never tried it. I can't say that I know any patients that have. But sounds not bad because it's got cinnamon. I love cinnamon. Okay? If I could ever bring to Canada our insulin balance, which was the best formula in the world by far for blood sugar. I get a migraine, but it had cinnamon in it. It had chromium picolinate, which is the best chromium, to help regulate your blood sugar and insulin resistance. Really, really good. One of the key ingredients was alpha lopaic acid. Alpha lopaic acid. I love that product. 30-something years ago, I used to use that product, alpha lopaic acid. There was a guy, a colleague, Dr. Richard Passwater, okay? And this guy was a genius and wrote so many articles and research. And one of his favorite supplements, he loved pine bark, by the way, and did research on it. But he, and I lectured with him, traveled with him and lectured with him. But he used to tell me all the time, alpha lopaic acid is so good for blood sugar, Dr. Martin. It is so good. And we're researching it and whatever. Okay? So, okay, I get a question, let's see, from Thomas. Is there any scientific research between eating before bed and dreaming? I'm sure there is. I'd have to look it up. Look, I don't like eating before bed. Okay? It ain't good for you. That research is pretty conclusive. Okay? Give your body time to digest before you go to bed. Okay? Like, you know, you don't want to be eating before bedtime. No. Because you want all of your systems to go into airplane mode. Okay? You want all your systems, Thomas, to go into airplane mode. What do I mean by that? Well, when you go to sleep, you want, you know what? When I'm sitting on an airplane, okay? This happened to me a few years ago. I had my phone out, and you know what they're like, turn your phone off. Well, I was just gonna turn it off, and the stewardess said to me, just put it in airplane mode, and you don't have to turn it off. I said, oh yeah? What's that? And she took my phone and showed me. This is airplane mode. Turn it into airplane mode. I said, what's that mean? It means you're not getting any data. Oh, okay, but you can still use your phone. Oh, okay. I get it. You need to get into airplane mode to go to bed. So if your digestive system is working, you don't want that. Now, Thomas, I don't think you're asking that so much as if that makes you dream. I don't know. I have to look it up. Maybe people can, okay? Maybe people can scroll and give Thomas the answer. I don't know. Okay? I don't know. I really have to look that up. And eating before bedtime and dreaming. Do you guys have the answer to that? Hey, I wrote a book, Sun, Steak, and Steel, and sleep. I talked a lot about sleeping. 80% of the population just about have trouble sleeping. That's a big issue. Okay. That was Thomas. Let me see. And Judy's asking a question about her daughter has monoclonal gammopathy. Okay. And why? I don't know. Okay. Here's my pet theory on it. They usually have had infection, I believe, viral, sitting there, and their body reacted to that and is reacting to that. And now their blood is full of protein and albumin. And it makes them more likely to get leukemia or myeloma. And look, here's what I if they were in my office, I'd do what I do on every patient. I would go through every one of their biomarkers, and whatever they're deficient, or if they have inflammatory markers or whatever, then I worked on those. Rather than say, well, this is what specific for that. Let's look and see what you're deficient in. So that's what I would do. Okay, Judy, like get all the biomarkers, CRP, vitamin D, B12, homocysteine. I would get all those biomarkers and see where that your daughter is at and take care of those things. And, amazing. what the body can do. See if they got leaky gut or whatever. Okay, Suzanne, what happens in our body when we're under a lot of stress? Good question. My understanding is that the damage to our body is the same as eating a lot of carbs and sugars. How does this happen? Well, yeah, I wrote a book, okay? 2011. At the 100-year, and it was an anniversary book. The 100-year anniversary of the Martin Clinic in 2011. Okay? I wrote a book. Well, we wrote a book, my son and I. Okay? Serial killers, 2 hormones that want you dead. What were those? Insulin and cortisol. And you're right, Suzanne, you're right, because your understanding is right. It's cortisol is like adding fire, adding fuel to the fire of chronic disease. Well, cortisol, think of it, okay? Uptight, you're stressed, anxiety. A lot of people don't even realize they're going through that. It used to shock some people, not everyone, but it shocked a lot of people when we measured cortisol in our office. And they would, what? My cortisol is high? Yeah. And no wonder you're not feeling well. Okay? And I think what I'll do, it's a good time to do it. Why not? Let's do a cortisol day next week. I thought about it. I said, why not? Let's do a day on cortisol. And, you know, I did a seminar recently online, and it was a teaching for I teach. I'm one of the instructors for the College of Natural Medicine, okay? The World Health Organization of Natural Medicine. And I teach. I taught a course on the effects of sugar downline, okay? Like, you know, what does it do from your brain to your toes? The effects of sugar, insulin too, of course, but downline, even without diabetes, because it really is diabetes, but it's not diagnosed with diabetes. So I showed from your eyes to your skin to your liver. I talked a lot about the liver. And you guys know that, okay? Even the gut. What happens to your pH in your stomach? Just because if you're a carboholic, a sugarholic, it's very dangerous. Sugar is so toxic. The body is smart. And it will do everything to keep you away from diabetes. Okay, so that's over on this side. And what I'll do next week is I'll talk about cortisol and the effects downstream. Okay? Because when you think of this, okay, cortisol is long-lasting stress. Okay? Now we know for a fact, if your cortisol is high, usually you're not sleeping. If you don't sleep, your cortisol is high. Vicious cycle. Because it deranges, cortisol is supposed to be secreted along your circadian rhythm, okay? Meaning that cortisol is higher in the morning And what does it do? It wakes you up. So it's normal to have cortisol. And it's normal to have higher cortisol in the morning because your cortisol goes up and it wakes you up, elevates your blood sugar, elevates your blood pressure. Okay? It's on your side, except if it goes on and on and on, then you see how it affects your blood sugar? Because it's supposed to go down. But if it don't go down, your blood sugar's up. Now, it doesn't make you a diabetic, but it can create a cascade of problems. Okay? So why don't we do that? We'll do that next week. Okay? We'll spend some time going down the line of what cortisol, it affects everything, just about. And people don't even talk about it because they don't know about it. They know about stress, but they don't know all the implications, and they should. Okay? And today we live in a world, like my practice changed. There was a huge paradigm shift of two hormones. Imagine I wrote that in 2011. I saw it was insulin going crazy and cortisol going crazy. And it ain't good. Okay, so we'll go into that because I think that it's time to do, it's not that I never talked about it before, but let's do that. Okay, so we got another session here. Oh, yeah. I talk too much. I got too many questions that I didn't get to. Okay, guys. I get on these rabbit trails and I don't come off. Okay, guys, we love you. You see how we want to spend a lot of time answering questions. So really, we could do question and answer every day. It could be our format. It really could. We get so many questions. Okay, which is good, but we appreciate them. Believe you me. My radio show, by the way, was question and answer. They gave me about 5 minutes to do a little study, and then they'd open up the phone lines. And they were jammed all the time. But we loved question and answer. Okay, so we love you guys. Thanks for making this such a success. Guys, what kind of a show would we have when we didn't have you? Tell your friends, share it, tell them they can listen to this again on their smart device on podcast. The Doctor Is In podcast. Okay, thank you guys. We love you. Talk to you soon.